with our metal-free tubes, we have one that has no additives at all. We also have one that has EDTA in it. These are for copper, when we're drawing copper, and when we're drawing zinc test for zinc. We see it a lot in main campus. We also see a lot of those draws in our outpatient clinics. Okay, so we have our metal-free. Sodium citrate. I think this is a hiccup for a lot of people. Do you guys get this tube back often? The blue tube.
Yeah.
Do they
Sometimes
return it?
Because sometimes it doesn't fill up all the way.
All right.
And like we say that it like it's supposed to be filled all the way, but then like it doesn't fill up all the way.
Right.
And so we put more blood in it.
So I've got a trick for you. You want to do a throwaway tube first. You can use a rig as a throwaway, or you also can do another blue. Only because some patients, we have patients that are either severely dehydrated or they're not a easy stick. So you want to go ahead and do maybe about 0.5 mils first, then collect. It will feel like it never felt before. It will flow. Now, what you want to guard against is overfilling as well, because overfilling could be an issue. They will send an overfilled tube back. All right. So we got our throwaway first, then our sodium, right? All right. So back to our order of draw. We have blue, gold. That's our serum separator. We also have our clot activator tube, which is our red tube. We have our dark green. I've been saying blue. And we have a dark green. Do you guys draw beta hydroxy? All right, so you have that dark one first. If you have something like a CBC or a CMP or maybe a lipid panel or something like that, that would be the next tube that you would draw. You have your purple. You have your blood bank, right? Which is our pink. Blood bank, let's talk about that really quick. So, of course, we know we need 2 signatures, all right? Personal testimony, let's say it that way. I had a patient that had two armbands on. One was that patient's armband, one was another patient's armband. That patient had a blood bank. What I think happened, I think once that patient that was in that room at the time when they were discharged, they just didn't pull maybe the unit secretary didn't pull the chart labels in the armband. So they automatically thought that was it. Put the armband on, had to call the nurse and listen, this is not scanning. What's going on? So then we found out that was the wrong patient, got it together. So if your venipuncture department is saying, listen, can you come in with me to verify? They're not being anal, they're not trying to take you off your routine. We just need to be sure, especially with our blood banks. Lactic. Another personal testimony. You guys know that lactic goes on ice, right? All right. It can be on ice too long, or it can be forgotten. I have forgotten to put it on ice before. I also had it on ice too long. So, rule of thumb, draw it, get it done, send it down. Put it on ice though. Let's go back. Rule of thumb. Draw it, label it, put it on ice, put it down. What I do to help me, I will put my tube on ice, draw the patient, put the ice in the tube in the bag, and immediately send it down. Because it's a time test. We want to make sure that it's done in the correct time. Our beta is a time test. This way, we have I believe a 30-minute window with our beta hydroxy. So we want to make sure we do those, get them done, send them down. ACD tubes, which is our HLA tubes. I know they resemble the urine tubes, but this is a blood draw. It's an ambient draw. Normally we use these in our outpatient clinics and also for our transplant patients. So you may not see these often, but this is a blood tube. Make sure that we properly clean. Once we clean, we don't pop our fingers out of our gloves. Some people in the lab have done it before. You guys are not the only ones. But we don't pop it off. Once we properly clean the area, we want to make sure that we're sure we know what we're going to do. We get that site, clean it, let it dry. We don't fan, we don't blow. We don't whip the people, you know, plucking them, DDTing them. We're not doing that. We're gonna put that tourniquet on tight enough to help with the comfort. It is an uncomfortable process. To help with the comfort, we want to make sure we put that tourniquet on their gown or maybe a long sleeve shirt that they, you know, wear in the hospital. Get that area, clean it, let it dry, get those sufficient lab drawers done, send them down, and that's it. Anybody have any questions for me? One more request, two more requests. When you get your tubes, be sure that you label it correctly, please. Don't put one label on 2 tubes and send them down. Even though we know that that is the patient, we don't know that it's the patient. People do it. Also, no crinkling up labels. Don't put them on here. Kind of put them, line it up with the labels that are on here. Because we have to put our labels on top of yours, mostly inpatient. And once they put them in the machines, we want to make sure that they can read them. Because if it's crinkled, if it's balled up, it kind of messes up everything, okay? So that's it, Rachel, it's in your hands.
So blood cultures, we're trying to decrease contaminations, obviously. It's very expensive. If we have contaminations, it's $4,000 or more. And when you have contaminations, you also risk having longer hospital stays, people getting antibiotics that they don't need, then becoming resistant to those antibiotics. So it's just more expensive for the hospital, for the patients, and it's could be detrimental to their health as well. So when collecting blood cultures, obviously you have to get it from 2 different sites, okay? You have to clean the area properly, pretty much what she just said as well, but you're gonna clean with alcohol first, let it dry. While it's drying, you're gonna prep your blood culture bottles, okay? You always wanna start with the blue, the aerobic first, in case it's a short draw, because if you get 1 blue, it can be considered a set or a PD tube, okay? But usually you're not starting with a PD tube. You'd know that for like your second set, obviously. So always start with the blue, aerobic, and then the purple, the anaerobic. You are going to prep the top of those with alcohol wipes as well. Then you're gonna clean the arm with the chlorhexidine. Just like she said earlier, you're not gonna repalpate, you're not gonna do any of that. Then you're gonna stick and you're gonna collect the blood cultures. You wanna make sure you have at least 5, no more than 10 milliliters of blood in those blood cultures. And there's actually markings on there that you can see. You wanna, when you print up do y'all use Curins where y'all are at? No? Sometimes. So if your facility has Curins, obviously use the Curins. They're supposed to decrease our contamination rates. When you do use the Curins, you want to send your Curin slip with your blood culture. So when you print your LSID labels, you have that first set, it's 2 labels, and then right underneath that first set, there's an extra label with the patient's name, but they have numbers that match the other 2 labels. So you want to put that label on your Curin slip. Right? So your 2 culture labels on the bottles, and then that extra label goes on the Curin slip and you send it with the set of cultures. So 2 different sites. Make sure that when you're collecting it in Epic that you're collecting it from 2 different sites. If you just print it and collect it all at one site, it looks like you collected it from the same site. That's pretty much the gist of it. You want to also make sure your bottles aren't expired. You want to make sure like the septum isn't messed up, that's the top of the bottle, that it's not defective or cracked or anything like that, obviously.
You guys stick often?
Unfortunately.
Oh, it's not do you stick, sweetheart? Okay, so come on, let's practice. Yeah, but I'm gonna show you what to do.
Collect them
Okay.
15 minutes apart.
All right, so get
No,
your
well, also
gloves.
if you're going from like a central line or something like that.
I thought you were never supposed to collect from a center.
You can collect from the central line. That is, you're supposed to do it at least 15 minutes apart.
So you gotta go.
We do at the West Wing, and we did it at Kettering.